Hi there, and welcome to another show of the Ask Dr. Jack show. I am Dr. Jack Belitz, your host, and here to answer the questions that you ask. Today, the subject is something very near and dear and special to my heart, and what it is severe low back problems. A new study has just been released. Now, this doesn't completely, perfectly apply to what we do here in the clinic, but the results are very important if you are someone that you know are considering back surgery. What this study did was it looked at the effects, both short-term and long-term, of doing back surgery versus what they call conservative treatment. Now, conservative treatment is not anything as special as what we do here in this office, and I want you to understand that going into this. What they're probably talking more about is bed rest and maybe a little physical therapy. But what they did was they took 370 men and women with documented herniated discs. Half of them had surgery, the other half had the conservative treatment. They measured how well they did at intervals of 3 months, 6 months, 1 year, and 2 years out. Now, here is the really amazing thing. They found no differences in any of the measurements at any time, including the reduction in numbness or weakness and the quality of life of the patient after either doing surgery or the conservative treatment. So what the heck are all of these people doing subjecting themselves to surgery? This is a really important thing. Now, obviously, the success that we have at this office, which right now is documented at 92.3%, is phenomenal. Now, I don't get those kind of results with every single person that walks in this office. What we do is 2 computerized tests to see if you even qualify for the type of care that we offer. And then once you do qualify, you have to be willing to subject yourself to a fairly rigorous 9-week minimum program. But if you do, we have an amazing chance of getting you out of even the really severe sciatic, really bad stuff. So keep this study in mind when you're deciding whether or not you want to do surgery. Because even if you don't want to go to a chiropractor, this particular test is showing you that bed rest is as good, if not better, than surgery. Because if you got the same symptoms after any period of time and you weren't changed forever because somebody cut on you, it's going to be a lot better to not do the surgery. So, if you are considering surgery, please have your loved one, yourself, whoever it is, come into the office. Just get an exam to see if you even qualify for the care. Because if you don't qualify, no big deal. If you do qualify, then we'll talk about your options. See whether or not this is something you want to work with, want to deal with, whatever. But at least look at this option before you subject yourself to surgery. I have at least half the patients that come in to see me with the really severe pain have had at least 1 failed back surgery. And I can't get the same results with those people that I can get when they haven't had a failed back surgery yet. Now, I can get them a lot better than they would be without it. Don't get me wrong, that's huge important. We can totally add quality of life to their life. But it's so much better if you do this before a back surgery. So that's it for this episode of the Ask Dr. Jack show. I am Dr. Jack Belitz, a chiropractor in Omaha, Nebraska, here to give you information that you can use to decide what you want to do with your life. If you have any questions that you would like us to answer, email us at askdrjackb, that's B-E-E, @gmail.com, or give us a call, 402-333-4848. Or stop into the office in person. Ask your question. We'll get right on the research and we'll get you the results. Have a very happy and healthy day, and I'll see you in the next episode.